and welcome to the New Mindset, New Woman show. This is a wellbeing series for women in midlife, offering expert insights and practical tools to support holistic health. So, I am Georgina Hickman. I'm a functional medicine practitioner and a bank registered nutritional therapist. And what I do is I support high achieving women aged 40 plus with hormonal and digestive issues. And really, the aim is just to have them feel like themselves again. Today, I'm thrilled to have Caroline Smith on the show with me. So, Caroline is a dental hygienist, a nutritional therapist, a microfunctional therapist, and she also has a special interest in sleep. So, she's multi-talented. And whilst I could chat with her all day, what we've decided to do today is just focus on her work in holistic dentistry. And what we want to do is try and unpack for you a little bit how oral health affects hormone health. So without further ado, welcome, Caroline.
Thank you.
Can I ask you to start by telling us a little bit about your personal journey and how you ended up becoming the functional hygienist?
Yeah, sure. And yeah, thank you so much for inviting me on this podcast because the mouth matters, and in the grand scheme of things, I think medicine and dentistry don't often talk to one another, and so it's nice to get kind of the importance of oral health and oral hygiene out there. I've been a dental hygienist for nearly 15 years, and probably about 6 years ago, I started getting frustrated with just being on the treadmill of, cleaning teeth, drilling and filling teeth. I'm a therapist, so at that stage in my career, I was also doing fillings as well and extractions of kiddies' teeth. And I just got really frustrated that quite a lot of the population either weren't responding to the treatment that I was doing, or, some parents would come in and say, "Oh, little Jimmy's not eating any sugar and he's brushing his teeth," and I'm like, how is there still decay there? That doesn't make any sense to me. And also, I just thought, nutrition's got to play a big part in this, so I decided to study functional nutrition. So we studied together at the
Yeah.
Northern College of Acupuncture. Um, the first year when I started studying,
Mm.
um, everything kind of started making sense. Those questions that I was asking in my head, I was all of a sudden getting answers for. I went through that stage of being a little bit angry, I suppose, because I wasn't taught this stuff at university, what the impact that stress has on gut function or chewing function, the impact that poor sleep has on immune function. I wasn't really told or taught those things, and I started then following a lot of more functional dentists. So functional dentistry is basically, looking at the mouth and what its functions are and supporting the functionality. And the main function actually of the jaw is to support the airway musculature. So halfway through my nutrition course, I was kind of like my eyes were open to this area of airway health, and actually whatever nutrient we're trying to put in our body, getting oxygen to those cells is the most important thing that we need to be doing, because of a lack of oxygen to the cells, then they don't function appropriately. So started studying kind of airway health and muscle function and nasal insufficiency, which then impacts sleep. And everything just changed. And I just couldn't see that my patients in the same way. So the first thing that I would be asking in my head is, oh, can that person breathe? It's fundamental. And a lot of the patients who struggle to go back in the chair or hate the water, all of a sudden I was thinking, oh God, they feel claustrophobic. They feel like they're going to choke because they can't actually breathe with their mouth open at the same time. So it gave me a deeper understanding of some of the patients who really struggled with actually having dental treatment done. So, sometimes when we're doing a filling and we need isolation from water, you put a rubber dam on there, but if you're trying to breathe through your mouth with a rubber dam on, that's not going to end very well. So just having that kind of like understanding of, oh, actually, there's an underlying breathing dysfunction going on there, and what can we do to
Mm.
restore functionality in the breath? Um, so yeah, I still work in conventional dentistry. I don't really drill and fill anymore. But my main focus then went on to, well, how can I use my knowledge to help that patient in front of me restore function back in their mouth? How can we support the musculature? How can we support nasal breathing? How can we support an anti-inflammatory lifestyle? How can we support proper brushing and cleaning? You know, a lot of the patients that I was seeing who had this, oral obstructions were finding it really difficult to brush in certain areas of the mouth. So kind of navigating around gag reflexes, understanding kind of the influence that cranial nerve dysfunction has on muscle function.
Mm.
Now I see my patients from this whole different like landscape. And what I do now, in general practice, I kind of it was really difficult at first because I thought, oh my goodness, like I can just see so many things here. Like, where do I start? So
Sure.
now I just drop the seed and I just ask, oh, you might struggle to swallow. You just put your hand up or give me, time, like put your hand up if you need to have a rest in between the treatment. I've noticed that you're struggling to breathe through your nose consistently. I've made like a general email about how you can support that. Would you like me to send it to you? So I found that a really nice, gentle way in.
Hmm.
I've given people a bit of information, but really emphasizing the importance of the breathing. I worked for the last kind of 18 months, has it been? Yeah, down at a biological dental practice in Huddersfield.
Hmm.
So working with the team who really focus on airway health and early intervention, orthodontic, muscle function more so, and safe amalgam removal. So for patients who are really susceptible to the like toxic load, or they might not be able to detoxify very well, then
Yeah.
these patients need extra support to help in that process. So that team down there does that. Like I say, I don't tend to drill and fill anymore, and I do work in general practice. So a lot of my patients, as I was giving them information, they're like, "Oh, that's not like normal kind of information that we get off a hygienist." So I was like, "Oh well, I've studied in this. It's more like functional hygiene." So I've kind of coined the term myself. I don't know if
Yeah.
there's any other hygienists out there who would say that they're functional hygienists, but in the hierarchy of what our mouth is for,
Mm.
if we didn't have a lower jaw, then all of the soft tissue would fall into the airway space. So the main role of this lower jaw is to support the airway. Then, of course, we need to be chewing our food. For us
Mm.
to be chewing our food, we need like good mobility of the tongue to help us do that. So we need it for digestion. We produce, salivary amylase in the mouth to start carbohydrate digestion. Um, and of course, we need the mouth to communicate as well.
Mm.
So yeah, I've kind of like looked at my skill set and thought, oh, actually, yeah, it's functionality is my main goal. And when we're thinking about the mouth and brushing and cleaning, it's like, well, how has that how has that influenced the environment by the function not being, optimal?
Yeah.
Um, so I found that, a lot of patients can come in and they're trying to put probiotics and this, that, and the other. And I'm like, oh, actually, so are you drinking enough water? Are you actually
Yeah.
breathing through your mouth? Is it changing the environment, which will influence which bacteria will actually survive or not?
Great. I love the way that you piece everything together. It's like you're looking at the big picture when it comes
Mm,
to oral health and the mouth, just in
mm,
general, I suppose. But really great that you're able to do that and make those links.
Mm.
and sort of almost explain the or put piece together a jigsaw for somebody.
Yeah.
How helpful is that? That's great. So you often describe the mouth as the gateway to the body.
Mm.
Can you explain to me, for our listeners, what the role of the oral microbiome is in regulating not just oral health,
Mm.
but how that also influences our systemic health, so our whole body health?
Yeah, of course. I mean, it's such a, when we think about it, it's the only part of the body that is kind of open to such extremes of
Mm.
different things. Extremes in temperature, extremes in acidity. It's next to the gut, it's kind of like the second most populated, bacterial biome in the
Mm.
whole body, and it's home to kind of over 700 species, and even different parts of the mouth kind of build up different species. And I think the model of kind of disease was always, oh, all bacteria are bad.
Mm.
And I think, the development of antimicrobial mouthwashes, this we kill 99.99999% of bacteria. And
Sure.
it's like, oh, actually, some of that bacteria is actually beneficial.
Mm.
So do we want to destroy everything, or do we want to kind of adapt and create an environment, like I said before, for those beneficial bacteria to survive? So, for example, I'll always go back to the breath. We've got bacteria kind of that sit kind of on in the mouth that turn foods with natural nitrates like beetroot, whatever, like they turn that into nitric oxide, and the nitric oxide that is produced when we inhale that nitric oxide, it's a vasodilator, it's a bronchodilator. It actually helps us with gas exchange and uptake of oxygen. So, you know, it supports heart health. Whereas
Mm.
if we're continuously using an antibacterial mouthwash that's just destroying everything,
Mm.
we're not going to have those microbes there that can do that beneficial job. So, you can liken it to the ocean. If you're going to go in there and put all of these chemicals in the ocean, the fish are going to die, aren't they?
Mm.
But actually, if we can start creating like clearer waters or putting less toxins in there, you're going to get a more beneficial environment. So when I educate patients, education is my favorite thing, and using analogies because
Yeah.
people understand it then.
Great.
And yeah, the ocean analogy, if you have an oil slick, then it's gonna damage all of the living creatures.
Mm.
So if you're trying to destroy all of the bacteria in the mouth, then yeah, you can long-term wise, short term, yeah, of course, if there's something happening, and you need to, use it for a few days, then that's fine. But long-term use of antibacterial mouthwash it's not great for the
Yeah.
microbiome.
Yeah.
Um, Hormonal shifts, for example, can influence kind of what bacteria will survive. And if you don't have, that if you don't have that microbiome, it can really affect the just how the body can function. It helps us, process foods. Um, it it can act as a protective barrier. So
Mm.
if you have gum disease, so
Mm.
gum disease. I wish I had pictures up now. So if you've got a tooth and then you've got your gum margin, and you might have kind of like inflammation of the gum margin. So we call it a pocket around a tooth. Inflammation is always the first sign of any imbalance, but disease is kind of classified as bone loss. So you can get deeper
Okay.
pockets, and down the deeper pocket, there's less oxygen down there, so kind of like bacteria that can survive without oxygen can cause damage at the base of the pocket. So, we're moving now to we can do saliva testing. You can get some dentists and hygienists do like a plaque sample where they put it under a microscope, and you can actually see the different bacteria on there.
Mm.
So different bacteria that look different or move differently, we know what kind of species they are, so we can actually see what's going on in the mouth. Even because periodontal disease is a silent disease, it's very much, oh, actually, this is what is going on in your mouth. I've literally just taken that plaque sample and put it under a microscope, and it's shown us that these pathogenic bacteria are living in your mouth. So that then hopefully will, well, I see it as being kind of a tool to promote change, or maybe more consistency with oral hygiene techniques. Because then if a patient comes back and they can see the difference, they know that it's them and what they've done that's influenced that. Because I think in medicine, in dentistry, kind of, especially in restorative dentistry, you go, okay, drill, fill, or put a crown on, and it's just, like you do it kind of step by step. Whereas inflammation, gum disease, that's lifestyle, and
Yeah.
also immune function and stress.
And so I guess what you're doing then is you're looking for more preventative early intervention,
Yeah.
sort of get, to catch things before the problems have really started.
Yeah, absolutely. And then you can start off that conversation of, oh, how, rather than demonizing what's in there, kind of like focusing on, well, what can we do to positively influence, again, the environment where the beneficial bacteria can survive.
Okay.
So yeah, I mean, this journey, a lot of this comes back to behavior change, and also patient management. Not, if you've got disease or inflammation in your mouth, then that human being behind the mouth is probably not doing too great. So you got to be quite mindful of, there might be stuff going on in their life that is causing
Sure.
that
Of course.
inflammation, and that might not come from, oh, poor brushing technique. That might come from, stress job, or things going on in the marriage, or hormonal influences. So yeah, because I've got that knowledge, I'm quite mindful of how I approach things. And yeah, I've learned over time that to ask permission, like, oh, would it be okay if we just chatted about this? Most patients are like, yeah, yeah, yeah. So no, and that's fine.
Right.
That's fine.
Yeah. And so what are some everyday habits, things that people might not even think about that can really harm the oral microbiome?
Um, snacking on sugar, snacking on
Okay.
sugar. Um, the when we eat food, the body needs time to rest. The
Yeah.
bacteria need time to process and clean up after themselves. When you eat sugar, the pH of your saliva drops. So the acidity in the mouth, it becomes quite acidic, in your saliva, because it's got buffering agents and enzymes and proteins. It helps to neutralize after about half an hour. So our body, you know, can withstand what, 3 or 4 sugar attacks or acid attacks. But
Right.
anything after that, you're more at a risk of more damage, because the body struggles to kind of bring everything back to neutralize. And so, if you've got, I don't know, kids eat sweets, I'm things, I'm not anti this or anti that, because it's just life, isn't it? But if they've got a packet of sweets, like, all right, we're going to have that after our meal. We're not going to snack on those constantly
Yeah.
through the night, because not through the night, but on an evening, because that is just going to be a constant sugar attack on the teeth. I think being pragmatic is really important, because sometimes when you try and cut everything out, that can be more of a stress on the body or the family. So yeah, you've got to kind of see where people are at and what can they change. And rather than cutting things out, focusing on adding things in. For example, if someone's having, I don't know, Weetabix for breakfast, can we then say, oh, do you know what? Actually, if we put some yogurt on there, that's got some protein. Can we add a few berries onto that? So that's gonna, help to stabilize. the blood sugar. I would say also making sure that your nighttime brushing routine is the most important brushing
Right.
routine.
Hmm.
If you're going to brush, put all of your energy into the nighttime, and then anything on top of that is a bonus. Yeah.
Okay.
Because when we think about it, bacteria's been building up during the day. Food
Hmm.
can get stuck in between the teeth. That buffer from the saliva that's happening during the day doesn't happen as much at night because we don't produce much saliva. A lot of the people that I see sleep with their mouth open, mouth breathe at night, so that
Right.
adds an extra issue because you're drying the mouth out. Those bacteria will build up a lot faster.
Right.
Um, the teeth, the surface area of the teeth, just say that's your tooth and that's
Hmm.
your gum. That little bit of gum is not attached to the tooth. So the toothbrush bristles really must go underneath the gum. It's not we're brushing our teeth, but actually the enamel is quite shiny. The bacteria find it quite difficult to stick to that shiny part. But just at that gum margin underneath here, that's where most of the bacteria will sit. So you
Right.
might brush your teeth and say, "Oh yeah, yeah, I'm not getting any bleeding." But as soon as I'll get the test drive. I use the Oral B. I'm not affiliated with Oral B, but I just love the IO toothbrush. So I'll get the IO toothbrush on the gums, and I'm only brushing it with the toothbrush, and I'll put it underneath the gums, and the gums will bleed, and that's just because they're not getting to that crucial area of
Okay.
underneath that gum margin. When we're thinking about the teeth and the structure, just say kind of this is the crown of the tooth, this is the root. Where the teeth come together at that contact, you've got that empty bit of space in between the
Hmm.
teeth. The bone level's here. So we've got that empty bit of space in between our teeth. And if we're not flossing or using an interdental aid,
Mm.
then actually we're missing a large proportion of the surface area of the teeth. So just being it's still after 15 years, one of my favorite things is just to teach people how to do something. The difference I see in weeks, like maximum 2 weeks, the reduction in inflammation is incredible.
Right.
Like, because you're consistently disrupting that biofilm. The immune
Mm.
system's like, don't really have to work so hard here.
Mm.
Everything starts to settle. It just means you're not swallowing the bacteria, it's not getting into your gut, your inflammatory levels come down. Things, in your drip, well, for me, I'm drip feeding kind of foods that reduce inflammation, high, the ones high in vitamin C, or I'm
Mm.
talking about foods with probiotics in, like a little bit of fermented food here and there. I'm just kind of gently educating them on
Mm.
what they can add into their routine and then teaching them how to do that cleaning up effectively. It just still blows my mind to this day how a
Yeah.
toothbrush can improve things.
Yeah. And so you mentioned obviously adding in like probiotics or anti-inflammatory foods.
Mm.
Are there any particular diet or lifestyle changes that you often recommend to support oral microbiome balance? So
I would
apart from
just,
that brushing technique that you've just
mm,
mentioned and using the interdental sticks, which we'll come back to, but from a dietary perspective, let's just start there. So
mm,
obviously you've talked about reducing sugar,
yeah,
which I assume is quite a big thing.
yeah.
And but also you just mentioned there adding in like probiotic foods and things. So what would you be your recommendations there?
Well, I suppose it's meeting that person where they're at,
It's
talking about,
individual.
yeah,
Yeah,
talking about
yeah.
kimchi to a 6-year-old. We probably wouldn't really get very far with that. But like yogurt, like going back to kind of that
Yeah.
Weetabix, educating, yeah, the yogurt's got protein, it's going to help strengthen the muscles, especially I talk about the tongue a lot because it supports the airway, and then educating them, it's got these really good bacteria in there that are, they're going to help you do really good
Mm.
jobs in the body. um Kimchi, like sauerkraut, so yeah, all those, like maybe reverting from softer bread to sourdough bread, very subtle little changes
Mm,
because, you know, if a patient is inflamed, that can be quite overwhelming,
mm,
like a lot of things. So eating the rainbow, can the patient eat, different colors of the rainbow every day? Really, really simplifying it, not
mm,
having to go from zero to hero in a day. And
mm,
just, sometimes I'll give them the band picture printout and I'll just say, just stick it on your fridge. It's just a
mm,
little gentle reminder of, oh, do you know what? I haven't actually eaten any greens today.
mm,
And that for some people is enough to just kind of like trigger them to think about things.
mm.
Um, yeah, like I say, I use the band plate a lot,
Yeah, so
just as a
that's just
visual
yeah.
representation.
And is that you're just trying to get people to think about balancing the plate there, I assume? Is it?
Yeah,
Like
yeah,
trying to make sure you're getting the element of protein, carbohydrates, and fiber.
yeah.
And actually, just our interest, how important is it that we're not eating like soft food all the time? So, we have to eat some harder foods, don't we, to like actually activate the musculature and make sure it doesn't weaken. Is that right?
Yeah, yeah, absolutely. Chewing has so many functions.
Yeah.
So chewing our food. So when bone grows, so we are not the cells that we were born with. We're constantly overturning.
Mm,
So the bone that houses the teeth, the cells are constantly overturning. Yes, we need vitamin D and minerals, but those cells need stimulation to
yeah.
actually do that job. So when I first meet a patient for the first time, I've got these visuals up and I will go through the parts of the tooth, how, nutrients are delivered to the teeth, how they're removed. And I talk about chewing a lot because, like I say, chewing stimulates bone growth. And
Yeah.
if you've got a patient who's got, I don't know, a tooth missing on one side and they're constantly chewing on the other side, this muscle, the masseter,
Mm,
um, is going to get overused. This
mm.
masseter will get quite weak. That can lead to issues with the jaw, and you can, get
Yes, as I'm well
bleeding.
aware.
Yes. Um, so yeah, again, going back from that, oh, well, you got you're eating soft white bread.
Yeah.
Can we revert that to white sourdough? Because not only are you going to get that food that's been pre-fermented by the bacteria, but you're also going to be chewing and using these muscles to
Mm,
to actively to chew. Chewing stimulates saliva production. Chewing also helps get rid of the metabolic waste that we produce in cellular respiration. So the lymphatic system will remove that cellular waste. So we've got to get fresh blood. I think quite a lot of the time we focus on, oh, putting this in, and then forget about, oh, it has to process, and then we have to get rid of it as well.
yes.
So the chewing actually helps us, pump the lymphatic system, so it's actually helping us get
Mm,
rid of that
waste.
that cellular waste. Yeah,
Yeah.
I say actually going back to kind of function and chewing and pain and things like that,
Mm,
we've got to really think about how the nervous system is impacting that,
mm,
because if you have had an injury to your head, neck, shoulder, jaw, and that is kind of impacted the nervous system, and then that can then relate to neuromuscular pain. So pain
mm,
quite often, especially in the jaw, I think in dentistry, we're a little bit nervous about like, oh gosh, there's jaw pain. I don't really know what to do. But actually,
mm,
if you look into it a little bit deeper and understand the pain patterns and understand the difference between an inflammatory pain and a like a muscle pain,
mm.
then you can actually help that person a lot, because quite often movement is the key to their certain pain, whereas you feel pain and you don't want to move.
Yeah.
So you've got to understand the difference between what actually is that pain,
Mm,
because yes, if it's inflammatory pain, you treat it in a completely different way to if it's neuromuscular. So I work quite closely with chiropractors, and I have had a lady who, I do a deeper history, and she's in
mm,
her 40s now, but in her early 20s, she was in a car accident, and, the pain patterns were very kind of constructive, that's kind of maybe where it was, whether her hormonal fluctuations all of a sudden triggering that pain,
Yeah,
because we're very
maybe.
sensitive to chemical changes. And actually just teaching her, okay, that pain that you're feeling when you're that the stretching exercises, that's actually going to help you with the pain. And every session that I do is always an educational session, because I'm teaching them how their body is responding to what is going on. And it's been life-changing for her. So I can't work with the spine, it's not my area, but the tongue is the rudder of the spine. So if I'm working on tongue function, and then I've got a practitioner working on posture and shoulder health, then okay, we're talking about then stabilizing those muscles, so we've got balance in the muscles. But you can understand that someone who's been chewing on one side forever and ever and ever and ever and ever, and then all of a sudden something happens, maybe just like, I don't know, like maybe they've stopped really suddenly at traffic lights, or something's just kind of like tweaked, and then all of a sudden they're getting this kind of pain. It's like, oh, unraveling those pain patterns and working back to stability. So I can't remember your actual question. How I got
I
onto
don't know.
that.
We've gone a
It
little
was
bit on a
chewing. It was
tangent.
chewing. Yeah, it was chewing. But yeah, chewing's really important. And those pain patterns can refer all over the, like, you might have headaches, but actually that pain might be coming from the neck.
Yeah.
So,
Yeah.
we've got the tongue. The tongue's got four muscles either side intrinsically, and then it's attached extrinsically, four on each side. And you've got a floating bone here, and then the way that the muscles are attached, if you've had if you've got a weak tongue or weak tongue muscles, then that can influence the way that you swallow. If I don't know, if you've sucked your thumb as a kid, or you've ingrained that infantile kind of tongue thrust swallow, it's going to change the way that the muscles work. Or if there's an oral restriction, that the tongue actually can't get into the place where we're telling it to, because it's got a fascial restriction, then the swallow will kind of sometimes be back to front, and that can cause a bit of like tongue thrust. It can make it means we have to use the lips to swallow. And going back to when we're doing any kind of work in the mouth, if you're lying back in the chair and there's water in there, and yes, there's a suction in there from the nurse, but I take for granted that I can use the back of my tongue to swallow. Some people can't do that because they've got those restrictions, or the muscles are really weak. So it's given me a lot more kind of, I don't know, when people come in and I see they've got oral kind of dysfunction, I'm like, well done for coming in, because this must not be a very nice experience for you. And just to have someone understand, sometimes like, oh God, yes, honestly, like, I hate coming, I don't like this. So just guiding them on gentle little things. I'll keep the chair sat up a little bit, I'll give them time to breathe in between, we'll do some breathing exercises, or I'll get them to pop a little bit of water in their mouth and hold their mouth back. Can you open it? Can you breathe at the same time? That's all I want you to do. Just focus on that nasal breathing. It takes the stress out of the appointment when people can actually like breathe, because it's really important.
Makes a lot of sense. So actually, that's a good place to ask this question. Is there a connection between oral inflammation or gum disease, if it's gone further, and our stress hormone levels?
Oh yeah, absolutely. Stress in every person that I treat, stress is the main trigger.
Yeah.
Stress doesn't always have to be mental stress, though. Stress, if that person, I don't know, let's just say the little kid, he's fallen off his bike, broken his nose, can't breathe through his nose anymore, reverted to mouth breathing. Mouth breathing, yes, keeps you alive. We can breathe through our mouth. But actually, it's not the way that the body is designed to breathe at rest. So that constant, over breathing, that's going to actually put a chronic stress on the system. stress can obviously come from life. And
Yeah.
like post COVID, I don't know whether it's well, I don't know whether other people feel, but I feel definitely life is more stressful since
Mm,
after COVID. There's a lot, I don't know, and I think a lot of it is like maybe social media or like
mm,
WhatsApp groups and this, that, and the other. It's like, oh my God, I've got so many things that I should be doing. That's a constant stress.
yeah.
Stress of the food quality,
Mm,
probably. Stress of school, stress of hormone changes. It downregulates everything and it affects your sleep, especially if you're a mouth breather and then you've got mental stress. And then, at night, if you're breathing through your mouth, the tongue inevitably is going to fall back into that airway space. So it can lead to a little bit more sleep apnea or upper airway resistance syndrome, which I don't think's talked about quite so much. And upper
mm,
airway resistance syndrome you normally see in, it's very abundant in thinner women
right.
with weak muscle tone, because
Right.
what you might not be holding your breath, but actually that gentle kind of like tongue falling back into that airway space, it's actually just stopping you getting into a deeper sleep. So yeah, you might wake up unrefreshed, but there might not be any snoring. You go to the doctors and like, oh no, you haven't got sleep apnea. It's like, oh, actually, like
There's
we need
something
to be,
there.
there's something there
Yeah.
actually. So I think upper airway resistance syndrome is maybe something that should be more educated on or talked about a little
Mm,
bit more. Um, stress stress downregulates the immune system. It downregulates, so we've got like immunoglobulins that are in our gut, and our mouth is the gut. And when we're stressed, we downregulate those
mm,
little immunoglobulins that are actually looking out for anything that we don't like. So if we don't have the kind of like the protector there to protect us, it's just a barrier that's compromised, so
mm,
things can filter through. The stress on the innate immune system, so if we're constantly got bacteria in our mouth and we're constantly having to send all of these innate immune cells, we need certain nutrients to help us make those, like the B vitamins. And
mm.
um so, if we're down regulating that and we're burning through those nutrients, eventually the body's going to go, ah, I can't be bothered. I don't know what else to do. So, yeah, I don't think people realize the impact of stress
Yeah.
um, on the system. And it goes both ways. Stress can influence inflammation. And if you've got inflammation, that can influence stress as well. So that you've got a nerve called the vagus nerve, and it's the 10th cranial nerve. So you got 12 cranial nerves. The 10th cranial nerve is the vagus nerve, and vagus means wandering, so it attaches to every other part of the body. So if you've got inflammation in your gut, it can send signals to the brain, and then vice versa. So you can imagine if you've got someone with weak tongue muscles, or they're snoring, or they've got a bit of upper airway resistance syndrome, when their tongue falls back into that airway space, the muscle at the back, the palatoglossal muscle with the dangly bit, the uvula, that's innervated by the vagus nerve. So
Right.
that can actually, if you're having chronic irritation of that in the night, that can make the body more stressed, because the vagus nerve doesn't like chronic stress. It likes short, sharp stresses. So what I often find is people with a gag reflex, I'm like, oh, is it worse on a morning? They're like, yeah, yeah, yeah. I'm like, oh, I'm wondering if there's a bit of snoring going on there. Oh yeah, my husband says this X, Y, Z. So that prevents them from brushing in certain areas. So to override the chronic kind of like airway obstruction, then I suggest kind of vigorous gargling before they brush their teeth, because vigorous gargling resets the vagal tone, and that can really help
Mm,
with being able to get in there with the toothbrush. We've also got a anti-gag reflex point here, just in the crease of your chin, CV24. So patients who are gagging, they can't breathe, I'll say, right, don't put any toothpaste or water on your toothbrush.
Mm.
This is just a mechanical brushing of the biofilm. Yeah, anything on top of that is, in the middle. I went to Africa once on a dental trip. They don't have toothpaste in the middle of Africa, but they've got a
Yeah.
tree that produces like this really beautiful bark, and it is really kind of like fibrous. And they pick a bit every day and they use it to brush their teeth. I'm like, let's just like focus on what
Mm.
is in your control. Because if you can't breathe through your nose and you're trying to brush your teeth, you're either going to do it really fast or it's going to make you like gag. Yeah.
Mm. Yeah,
So
sure.
rather than kind of to take the stress off the body, I'll say no toothpaste, no water, holding the anti-gag reflex point, especially kind of going around the inside of those lower teeth. It'll just allow you to get in there and disrupt that sticky plaque biofilm. So it's just navigating around the challenges that
Mm.
that individual is having, and that can make hell of a difference. Like holding that spot is, especially if you struggle with getting x-rays as well. It's a really good
Okay.
little thing to do. Because the body will do anything to protect the airway. So you can't
Mm.
stop the body from doing what it's doing because it'll do anything for protection, anything. So yeah, they're cool little ways to navigate around
Mm.
that. But yeah, stress is the thing that just triggers
Yeah,
everything.
it's a trigger for so many things, isn't it? So it makes sense it would be a trigger in this department as well.
Mm,
What about other hormonal shifts? So, like, often it's talked about, isn't it, in pregnancy
mm,
that, we need extra special dental care through pregnancy.
mm.
Um, how do those hormonal shifts show up in the mouth? And is it different between things like pregnancy and just a normal cycle? Do we have the same shifts just through our normal cycle?
Some people, if they struggle with hormone balance, they might find at certain times of the month that their gums
Yeah.
are quite inflamed. When we have estrogen is very protective of many things. It's protective of bone. It's protective of the mucosal barrier.
Mm.
It influences the microbiome. So yeah, if we have dramatic shifts
Swings.
in those
Yeah.
things, then it absolutely, yeah, it definitely can. So yeah, when we see gum disease, I often say, I do definitely see it more in women than I
Mm.
do in men.
Okay.
That's not saying men don't get gum disease, but I do definitely see a large proportion of it happening in that perimenopause kind of those
Yeah.
years. Um, so those fluctuations, especially if what I often find as well, scratching beneath the surface of what is going on in that woman's life. They might have elderly parents that they're looking after. They might have young children that they've still got at home. There might be things going on with the husband or work. There's often kind of like a layer of lots of stressy things that all of
Mm.
a sudden in a body whose genetics predisposes them to more sensitive body to inflammatory cells, then it's
Mm.
like, oh, it's like the perfect storm,
Right.
basically.
Yeah.
So yeah, the three I often say the three P's: puberty, pregnancy, perimenopause. That's when
Yeah.
we kind of often see things that might be stable all of a sudden kind of be driven more.
Mm.
And whether that is also influenced by behavior changes, because,
Okay.
inevitably your lifestyle might change if you're going through that and feeling stressed. But yeah, I don't see a lot of hormonal changes kind of like from general cycles, unless maybe there's more of a glucose dysregulation, maybe an underlying kind of insulin sensitivity,
Yeah.
insulin resistance. I'm quite keen to maybe do some glucose monitoring on some patients with um with gum disease just to see
Mm.
what is going on during the day, but also during the night.
Yeah, because I bet there could be quite a strong connection there
Yeah,
with like blood sugar dysregulation and inflammation and
yeah.
changes
Well,
in the mouth.
in dentistry, we 100% know the link between periodontal disease and diabetes. It's like,
Mm,
one influences the other influences the other. So we absolutely know that
mm,
that does, and there's a lot more practitioners testing, but wouldn't it be lovely that, okay, we'll test for diabetes rather than sending them off to the doctors and getting them put on metformin? Actually,
mm,
let's just reevaluate what's going on. Is there anything that is in their power that they can work on for, I don't know, 3, 4 months, and see if we can get those bloods more stabilized?
mm,
I definitely see that is that that could be a pathway to helping us detect diabetes in people, or helping us to reverse diabetes by improving oral health, because again, inflammation drives
yeah.
blood sugar dysregulation, and vice versa. So
Mm,
can we all work together as a team and be like, oh, actually, this is what is in your control, and we can actually measure that by looking at inflammation in your mouth, or we can, put a blood glucose monitor on you, but educating them in a positive way. I think there's lots of scope for that.
mm. Okay, great. All right. Well, I just want to wrap up by asking you, what does an optimal daily dental health care routine look like? So you've already mentioned that it's more important to brush at night.
Mm-hmm.
And we've touched on other things, haven't we? Like avoiding antibacterial mouthwashes and
Mm.
possibly using interdental sticks. Could you just bring it all together for us and tell us, what your top tips would be, I suppose, for a daily dental healthcare routine?
Yeah, I would first and foremost, I would just develop one strong nighttime routine.
Mm,
If we can focus on that, mastering the toothbrushing first. I'm a big fan of electric toothbrushes. The difference I see in people's mouths is amazing. The new technology from Oral-B, the IO, is flabbergasted. Like, I get flabbergasted at how good it is, but you've got to be using it properly. Find a routine that works for you to clean in between the teeth, and
mm,
you know, having the skills to do that, and practice and practice and practice. Have a practice of brushing the tongue as well. The bacteria
mm,
can stick on the tongue. I don't use a tongue scraper, but you can get tongue scrapers. They can be quite effective. Um, some people oil pull as well. Oil pulling for me is more of a myofunctional exercise. So you're using your muscles, you're using your tongue. You've got to
yeah,
do it for
makes
20
sense.
minutes. It's quite intense, isn't it? So
Mm,
if people want to oil pull, I'll say, why don't you just do it on a shower in the morning? Because it's actually then waking up your muscles, and it's forcing you to breathe in and out through your mouth as well. So it's, for me, I really like that as a myofunctional exercise.
are you meant to do that away from brushing and things? Like, is it a separate exercise?
Um, I mean, I don't really know the science too much behind it. I
Mm,
don't really know if there's much science behind it, but
right.
for me, from a logical perspective, um, I, if you're gonna have to do, if you want to do it for 20 minutes, add it on to something else that you're already doing, because
Yeah, because
yeah,
it's a
yeah.
habit stacking
It's
exercise sort
habit,
of thing.
yeah, habit stacking exercise. Um, but it's not something I talk about regularly. I know a lot of holistic
Okay.
and biological dentists do. It's just not something I do. Um, so yeah, I would just have a very, very basic, have a nighttime routine of brushing and cleaning incidentally. Stay hydrated. 99% of your saliva is water.
Mm,
So staying hydrated and making sure that you're having enough minerals. So fruits and vegetables, we get
mm,
all of those from fruits and vegetables. Making sure that your blood sugar is stable as much as you can. So proteins and fats and fiber on your plate. Giving your body time to heal and rest in between eating
mm,
will help to stabilize. the blood sugar as well. And yeah, very, very, very basic bits of information. But if you've got gum disease that is non-responsive, then it's important to work out what else is going on. So, I've just been working with a lovely lady, and there was just something, and I was like, oh, the body's not responding in the way that it should there. So I sent her off for her bloods, and she was severely anemic. So, if it's not responding in the way that it should, we should really have the confidence to say, oh, actually, what else
Yeah, it's about doing
is
that
in
deeper
there?
investigative work and making the connections that you've already
Yeah,
mentioned.
definitely. I mean, I'm doing an autoimmune course with a practitioner at the minute, and I think there's definitely a lot of underlying autoimmune links.
Yeah,
And, there are many oral bacteria that have got systemic links to
true.
autoimmune diseases like rheumatoid arthritis, P.
Mm.
gingivalis, for Alzheimer's. So,
Mhm.
you know, if brushing and cleaning alone is not enough, then we have to think, okay, what is the next level of the
Mm.
onion that we need to unravel to work out what else is going on there?
But on a basic level, what we're looking at then is making sure we've got a good daily evening routine
Hmm.
for brushing and incidental sticks. Is that what
Yep,
you recommend?
yep.
Is there anything that you recommend instead of an antiseptic mouthwash, or do you like to keep it like basic?
Yeah, I don't use any mouthwashes.
Yeah.
I don't use anything like that. Um, yeah, I keep
No
it very
need. There's no
basic.
need,
There's no
basically. Just
need.
get your food right and your lifestyle on top of your
Yeah.
daily brushing. Is that your
And
advice?
and and don't go over those basics. And then
Mm.
if there's still things going on when you're doing the basics and there's still inflammation,
Mm.
then we have to think, okay, well, what else are we missing here? So
Yeah.
the basics is enough in the majority of people.
Hmm.
Um, Inflammation reverses 7 to 10 days. Like it's amazing. It is
Yeah.
absolutely amazing. I think sometimes when people start brushing, I'm sure a lot of people will start brushing underneath their gums after this. Don't be alarmed if you see bleeding. Bleeding's your body's response to something that is trying to protect you from. Your body's always doing anything in its power to protect you.
Mm.
So inflammation in the mouth is exactly the same to inflammation as an open wound on your skin. That open wound on the skin, if I had bacteria there, would never heal. You have to
Mm.
go through that uncomfortable couple of weeks of like, oh, I've just got to clean this up and allow the body to
Yeah.
heal. It can be a bit uncomfortable, but that you should see a big shift in healing if you're
Mm.
consistent with that. But if the gums are not healing, then yeah, we
So
have
you
to.
recommend giving it 1 to 2 weeks, and if there's no changes, looking deeper?
Yeah, yeah, yeah. The
Yeah.
inflammation should reverse 7 to 10 days.
Right. Okay.
Yeah.
Well, that's really
If
good to know.
yeah, and if you've got like a mouth, so this is how. So when a patient comes in and I see inflammation, I'm like, okay, just say they've got 80% inflammation. What I
Mm.
normally find is after 2 weeks, the body's healed about 50%. So in an 80% inflammation mouth, I'll teach them the oral hygiene skills. We'll get them back. It normally comes down by about 40%. If they've been diligent, like, really clean and really well every single night, have changed their diet, I can see inflammation go from like 80s to 2%. Like,
Right.
that amazing.
Yeah.
Um, but sometimes it takes a few sessions of cleaning things up,
Mm.
making tweaks, changing this, that, and the other, that, there's gentle changes. But if you don't go to the dentist, you don't know what your gum are, you don't know your pocket size, you don't know your bone levels. I would really encourage you to at least see a hygienist to give you that
How
information.
often? How often?
It depends.
Yeah.
So if you've got no inflammation, whatever, once a year is absolutely fine.
Okay.
If you've got gingivitis or if you've got, deeper pockets, you might need an initial course of treatment to get you back to that stabilization phase. Some people who, I don't know, are more stressed, who know that their routine's not great or their diet's not great, they might need to come more often because the biofilm's not going to be as healthy. So it's very, very person dependent.
Okay, all right. Well, thank you ever so much for coming in to talk to us. It's been absolutely
You're welcome.
fascinating. Loved it. And if you've been interested in what Caroline has to say and you'd like to contact her, I'm going to put in the show notes some of your contact details. Is that right?
Yeah.
So they'll all be there. So feel free to reach out to Caroline if you've got questions or if you like the sound of working with her. And yeah, otherwise, it just leaves me to say thank you for being a guest today,
Thank you.
and we'll wrap it up. So thanks so much.
Thank you.